Inability to actively dorsiflex and evert the foot drop. Dorsiflex and evert. Dorsiflex and evert the foot is foot drop. Common foot drop causes: ruptured disc, total hip replacement, sciatic nerve tumor, traumatic knee injury, tibialis anterior, affected peroneal nerve. Common foot drop causes: traumatic tendon injury to dorsiflexors of foot, tendon injury, dorsiflexors of foot, tendon injury, neurogenic, at or below the level of common peroneal nerve, at or below the level of common peroneal nerve, direct injury, incised and penetrating injury, fracture and dislocation, fracture of lateral condyle of tibia, fracture, dislocation of head of or neck of fibula, dislocation of knee, compound fracture of upper one third of tibia, compound fracture of upper one third of tibia. Iatrogenic, high tibial skeletal traction, high tibial skeletal traction, high tibial skeletal traction, iatrogenic. Tight plaster around knee, high tibial osteotomy, TKR, above the level of common peroneal nerve, fracture of shaft of femur, posterior dislocation of hip, dip intramuscular caps, injection, PIVD, spina bifida, if any, cerebral tumor, space occupying lesion of CNS, infective leprosy, poliomyelitis, Guillain-Barré syndrome, syphilis, metabolic diabetes mellitus, beriberi, alcoholic neuritis, exogenous lead, arsenic and mercury. Lead, arsenic and mercury. Foot drop develops due to damage to lateral popliteal nerve, due to damage to lateral popliteal nerve, damage to lateral popliteal nerve. Paralysis of anterior muscle giving rise to foot drop. Anterior muscles. Characteristic high stepping gait. Ball of foot instead of heel. Hits the ground. Ball of foot instead of heel. Touches, hits the ground. Inversion of foot leads to overloading on outer part. Inversion of foot leads to overloading on outer part. Vulnerability of peroneal nerve. Fascicula of peroneal nerve larger and less connective tissue. Fascicula of peroneal nerve larger and have less connective tissue. Fear autonomic fiber in any injury. Motor and sensory fiber bear the trauma. More superficial course, especially at fibular neck. More superficial course at the fibular neck. Adhere closely to periosteum of proximal fibula. Adhere closely to periosteum of proximal fibula. Cutaneous sensation is impaired over lateral aspect of lower leg and ankle and dorsum of foot. Cutaneous sensation impaired over lateral aspect of lower leg, ankle and dorsum. Reduced dorsiflexion.